Good afternoon, everyone. Myself, Dr. Maheshwari. I'll be talking on Trash to Treasure RETCAM, Treasure to Save Sight amidst pandemic. Diabetes is a global epidemic disease, and India is considered to be a diabetic capital of the world. It is projected to grow to a 101 million by 2030 and 134 million by 2045. Proliferative diabetic retinopathy and diabetic macular edema are two main sight-threatening components of diabetic retinopathy. The National Survey of 2015 to 19 reported that 16.9% of those with diabetes mellitus had diabetic retinopathy in India, and 3.6% had sight-threatening diabetic retinopathy. Diabetic retinopathy meets the WHO screening criteria. The criteria for DR screening includes in type 1 diabetics within 5 years after diagnosis and annually thereafter, type 2 diabetics first retinal examination at the time of diagnosis of diabetes mellitus and then annually thereafter, women with gestational diabetes, not a known diabetic but with random blood sugar of more than 200 mg per deciliter or HbA1c of more than 6.5%. The aim of our study was to evaluate diabetic retinopathy screening using Trash to Treasure RETCAM at vision centers in rural and underserved areas in Tamil Nadu for teleophthalmology during pandemic. This is a prospective hospital-based study conducted at 11 vision centers over the time span of 6 months. Patients who visited vision centers were selected and informed consent was taken, detailed history and RBS was checked, visual acuity and refraction was done, ocular examination was done, and dilated fundus photography was taken using Trash to Treasure RETCAM. Image was remotely analyzed by retinal surgeon and graded, and patients requiring intervention were referred to the tertiary hospital. To tell about the results, over a period of 6 months in 11 vision centers, 1,904 patients were screened, and which included 851 diabetic patients, out of which 15% were already a known case of diabetic retinopathy and 85%, that is 61 cases, were newly detected diabetic retinopathy. 49 of 72 patients were referred to tertiary eye hospital for further examination and management. The mean age of patients in the study group was 54.4 years. Out of 49 referred patients, 14 were lost to follow-up. 56 eyes of 35 patients were diagnosed to have vision-threatening diabetic retinopathy and was referred in need of treatment. After clinical examination and multimodal imaging at retina clinic in tertiary hospitals, 45 eyes, that is 80.35%, were advised treatment. These are some of the images taken during the screening program. The treatment plan included panretinal photocoagulation, intravitreal anti-VEGF and steroid, and vitreoretinal surgery. Coming to the discussion, with the epidemic of diabetes mellitus related visual impairment and blindness looming on us, it is imperative that we take all measures to reduce the burden of sight-threatening diabetic retinopathy. At the height of the pandemic, elective services like community-based screening of diabetic retinopathy was halted universally to prevent community spread of COVID. Early detection of diabetic retinopathy by regular screening can help in slowing the progression of any diabetic retinopathy to sight-threatening diabetic retinopathy with good control of modifiable risk factors. The models of diabetic retinopathy screening includes hospital-based, community-based and teleophthalmology. At present situation of pandemic, teleophthalmology plays a very important role in screening of diabetic retinopathy patients by bridging the gap, distance, time and burden on manpower. The available devices for screening of diabetic retinopathy can be divided into tabletop, handheld and smartphone-based devices. These are some of the studies and international acceptance and concurrence that the screening of tests for diabetic retinopathy should have at least 80% of sensitivity, 95% of specificity and less than 5% technical failure rates. Coming to Trash to Treasure RETCAM, it is a simple, affordable, portable, wireless, do-it-yourself kind of a device which is done using an empty hand sanitizer bottle. It needs a mobile holder, a black chart paper, smartphone and a 20 diopter lens. These are some of the images taken using Trash to Treasure RETCAM. These are images of diabetic retinopathy. The Trash to Treasure RETCAM has been able to pick up findings like dot blot hemorrhages, hard exudates, soft exudates, superficial hemorrhages, IRMA, NV, NVD, tractional bands, laser marks and CSME. Although it can miss the diagnosis of mild NPDR, it has been able to diagnose sight-threatening cases. The parameters on which a successful teleophthalmology program can run are diagnostic accuracy and cost effectiveness. The study conducted to analyze the efficacy of trash to treasure RETCAM in diabetic retinopathy screening showed a sensitivity of 88.4% and specificity of 100%, and it cost only rupees 500 in making this. It also reduces travel and time, cost and loss of income of patients. To conclude, Trash to Treasure RETCAM is a smartphone-based telescreening device with very minimal investment which can be used in peripheral centers associated with multi-speciality eye hospital for screening. It is time that diabetic retinopathy screening evolved into ophthalmologist supported rather than continue to be an ophthalmologist-led screening program. The overall final cost benefit is larger than conventional screening programs. These are my references.